Heel pain is typically caused by stress to the structures that attach to the heel bone. The most common cause of heel pain is from plantar fasciitis. Plantar fasciitis is an inflammation, although recent research suggests that it is more likely a thickening of the plantar fascia, which is a band of fibrous connective tissue running along the bottom of the foot from the heel to the ball. Plantar fasciitis is considered a chronic injury, not an acute injury, as a result of plantar fascia being continually stretched past its normal extension, causing tears in the fiber, which occurs when the arch of the foot is elongating or falling. An unstable arch causes strain in the plantar fascia. This may occur when improper or poorly supportive shoes are worn, or when the Achilles tendon is too tight and puts strain on the arch. Symptoms may include pain under or along the side of the heel, which is usually worse first thing in the morning. Typically, the pain dissipates as the foot gets warmed up, but will begin to get worse as activity continues. Aggravation to the area may occur with improperly fitted footwear, improper foot biomechanics, training errors, and athletic activities including running, dancing, and jumping. Treatment options should focus on restoring stability to the arch of the foot. This would include a change of footwear to shoes which have a slight elevated heel and stiffness in the shank portion of the shoe. Over-the-counter arch supports can be helpful in early stages of plantar fasciitis, but often a custom corrective foot orthotic will be more effective to facilitate healing and prevent re-injury. Treatment options to relieve symptoms can include rest, taping, cold therapy using ice packs or ice baths, deep tissue massage, non-steroidal anti-inflammatory drugs, and stretching. A plantar fasciitis night splint, which is worn overnight and gently stretches the calf muscles and plantar fascia, preventing it from tightening up, may also prove beneficial. In more severe cases, cortisone injections, shockwave therapy, and surgery may be required. Another common cause of heel pain is Achilles tendinitis. Achilles tendinitis can cause pain in the back of the heel. This condition occurs when the tendon that runs from the calf behind the ankle and connects at the back of the heel is strained, causing tears along its length. The result is pain, inflammation, and possibly the development of a bony growth on the underside or back of the surface of the heel bone. This is called an insertional calcification of the Achilles tendon, and in some cases, lumps may develop on the back of the heels. Treatment options include rest, cold therapy using ice packs or ice baths, temporarily wearing a heel lift to take some of the pressure off the tendon, a non-steroidal anti-inflammatory drug, and taping the back of the calf to support the tendon and reduce tightening, along with stretching and strengthening exercises. In more severe cases, ultrasound treatments may prove beneficial. Early diagnosis and treatment should make for a good recovery. Do not ignore early warning signs and work with your podiatrist to develop a comprehensive treatment and rehabilitation program. Tarsal tunnel syndrome is most common in active adults. The burning or tingling sensation it causes is a result of the compressed tibial nerve. Other symptoms may include numbness and shooting pain along the bottom of the foot or inside of the ankle that may extend to the heel, arch, toes, and even the calf. These symptoms are often brought on or aggravated by overuse of the foot, including prolonged standing, walking, exercising for extended periods of time, or beginning a new exercise program. Early detection and treatment is very important in order to avoid permanent nerve damage. In athletes, this condition is usually the result of an ankle sprain and can also be brought on by a ganglion cyst, an arthritic bone spur, or a fallen arch. Conservative treatments such as arch supports and wider shoes may successfully relieve the discomfort of tarsal tunnel syndrome, along with anti-inflammatory drugs. Steroid injections also may prove effective, and if the problem is caused by flat feet, custom orthotics can help restore the foot's natural arch. If surgical treatment is necessary, your podiatric surgeon will make an incision behind and below the inside of the ankle and will cut the laciniate ligament, providing room for expansion of the nerve. If a cyst is impinging on the nerve, it can be removed to provide enough space to prevent the nerve from being compressed. The os trigonum is an extra bone that forms behind the ankle bone and is present at birth. Most people don't even know they have an os trigonum, and it is of no consequence until it gets caught in the ankle, sometimes preventing normal movement. Os trigonum syndrome is usually triggered by an injury such as an ankle sprain or the repeated downward pointing of the toes, which is common among ballet dancers, soccer players, and other athletes. The signs and symptoms of os trigonum syndrome are deep, aching pain in the back of the ankle when walking or when pointing the toes downward, tenderness in the area when touched, swelling in the back of the ankle, and decreased range of motion in severe cases. Conservative treatment includes rest, anti-inflammatory drugs, ice packs or ice baths, and cortisone injections. In some patients, surgery may be required, which involves removal of the os trigonum. This extra bone is not necessary for normal foot function, and a full recovery should be expected. Calcaneal apophysitis, also known as Sever's disease, is the most common cause of heel pain in young athletes and is a painful inflammation of the growth plate. It is caused by overusing the foot with repetitive heel strikes. It may also occur from wearing shoes with poor heel padding or poor arch supports and tight lower calf muscles. Signs and symptoms include heel pain on one or both sides when running, walking, or jumping, and a visible limp. When pain is present, the sports activity should be modified. Stretching the foot and calf muscles before activity and icing afterwards are also effective treatment techniques. Your podiatrist may also recommend heel cups or cushioned orthotics as part of a comprehensive treatment plan.